Here was Gucci with a Veterans Military YouTube, back again with another banger. Today we're going to be breaking down the new VA rating criteria for GERD, aka Gastroesophageal reflux disease. And let me tell you, it's not looking good for us veterans. So, as always, like the video if you learned anything from this video. Any of the information, share, subscribe, comment down below your current process, current opinions on this. Let's deep dive into it. You know what I'm talking about? So, as always, first of all, so before I dive into this, I just want to point out this comment that was left by a supposed physician on the VA's website. Hey, as a physician, I wanted to mention my thoughts on GERD changes. GERD is a separate disease syndrome from esophageal stricture, which is one of the main components of the new VA disability criteria. One can have GERD without esophageal stricture. In fact, GERD most often presents without a stricture on endoscopy. Typically, on endoscopy for patients for GERD, the scope will visualize one of many possibilities, including esophagitis, inflammation, and at other times the endoscopy will be normal. Rather than require an esophageal stricture for GERD, if the VA wanted an objective evaluation for GERD, they could have required an ambulatory acid probe, barium swallow test, or esophageal manometry. Instead, the VA is requiring esophageal stricture to be present within GERD from 0% all the way up to the 80% criteria for this, which does not make sense from a physiology standpoint about what GERD actually is. Moving on to the next. In recent studies, less than half of patients with GERD had any abnormalities on endoscopy. So, more than half of patients with GERD have normal endoscopy. And even in patients with abnormalities, esophagitis is most common, not strictures. So with that being said, the VA's standpoint is, appreciate your comments. She wasn't even one of the commenters. He or she wasn't even one of the commenters on the initial proposed changes. But the VA said, okay, the comments there, the VA obviously hasn't addressed it or taken a look at it. But this is what's going to happen. That new, and we're going to dive into it. The new rating criteria main deal is on the stricture. It's taking away a lot of things from the DBQ, from what is currently rateable, which makes it a lot easier for veterans to get service connected for GERD under the current terms. Let's move on into it. That being said, this is the current VA rating for GERD, which is currently classified under hiatal hernia, diagnostic code 7346, and it has these symptoms. Very good, very easy to report to your doctor, as well as it's easy for your doctor to record them at the 10, 30, or 60% VA disability rating level. Now, keep in mind, at the 60%, the VA is looking at symptoms of pain, vomiting, material weight loss, hematosis, what the hell, or melania, with moderate anemia and other symptoms, combinations productive of a severe impairment of health. Gucci. And in regards to this, yes, this is the rating criteria. However, the DBQ says a whole host of different things that needs to be present during the time of your CMP exam up until that point. So before I go into anything further, this is just information from those 6 commenters that did express their issues and concerns for the new VA rating criteria, because it doesn't have any symptoms of heartburn, regurgitation, sore throat, nausea, chest pain, difficulty swallowing, laryngitis, chronic cough, new or worsening asthma, inflammation, and the list goes on. It's completely changed. The new VA rating criteria for GERD has completely changed, and mainly targeting stricture, esophageal stricture. So I would say, for those of y'all who are at low VA ratings, who are trying to get boosted up, trying to get an increase, put in your claim now. Put it in now, you'll be cross-referenced between the both, and whichever one's highest, that's the one you'll be getting. But for those submitting claims past May 19th, 2024, you definitely want to be specific with this. So with that being said, look at the current, we're going to look at the current VA Disability Questionnaire, DBQ, for GERD. Obviously, there's not a new one out, but however, there will be a new one out on the 19th, and definitely your boy will be reviewing that one for y'all, just for your own essay. So, signs and symptoms, section 3 is the most important part of this DBQ, because does the veteran have any following signs or symptoms of esophageal conditions? Cool. And I'll list everything pretty much associated with the 30 and the 60%, as well as the 10%, but everything associated from up to this point with GERD. And it has all of those symptoms that was previously addressed that was taken out of the new VA rating criteria. I'll leave this up for a second, but one of the main things will be what? Dysphagia, reflux, regurgitation, pain, as well as sleep disturbance caused by esophageal reflux, as well as the occurrences. Moving on from there. Now we got the new VA disability rating criteria for gastroesophageal reflux disease. And you can see it has a foundation from 80, 50, 30, all the way down to 0% of what? Documented history of esophageal stricture that requires daily medication to control dysphagia, and the list goes on. But that is the main thing. Issues having esophageal stricture. Now, 80%, hey, you got it right here, with at least one symptoms present. Aspiration under nutrition, substantial weight loss, treatment with surgical correction of esophageal stricture or precutaneous esophageal gastrointestinal tube, PEG tube. There you go. And pretty much everything else goes, it goes from most severe to least severe, with everything mainly being surrounded around the stricture, the esophageal stricture. And with that being said, let's move on to some of the things that can identify that. Things that can capture esophageal stricture. CT scan is one of the most recommended. An X-ray can as well. To include a UGI endoscopy is the most preferred because pretty much camera down your throat, they'll be able to diagnose, view your esophageal area, see if you have any strictures, as well as they can render treatment at that time. To include taking pictures, all the damage, anything that's going on with that. Not a doctor, just explaining a little bit to y'all. You know what I'm talking about. Then we got the barium contrast swallow test, which can show any abnormalities in the esophageal area, as well as identify the severity level and size of the strictures, to include a lot more information. Include an endoscopic ultrasound that's going to give high resolution photos and imaging of your esophageal strictures. You know what I'm talking about. Just reviewing all the medical evidence, all the medical literature revolving around diagnosis, treatment, image capturing of esophageal stricture. It seems like it's going to be very tedious for veterans to get this service connected as well as get treatment. I'm not sure how deep the VA's capabilities go, but it seems like something that, we hear all the time. VA, we can take an example for PTSD, veterans with PTSD. And majority of cases, VA medical facilities, VA therapists take years to render a diagnosis and a proper identified stressor for PTSD. Who's to say that they have the capabilities or even the desire to take a veteran through the necessary steps, MRI, X-ray, endoscopic ultrasound, and the list goes on, of all of these identification methods utilized to identify any esophageal strictures, the severity, the size, how far it expands, and the list goes on. This is something that I think it will be best suited for community care or private care provider. But this is the new VA. This is going to be the new VA rating criteria for GERD. So it'll behoove y'all to educate yourself on this process. And definitely, if you're currently in the process for trying to get GERD service connected, you might be better off being rated under the current VA rating, if you got a claim in, versus that new rating criteria. Because I guarantee majority of veterans do not have that recorded in their medical evidence. Anything at all when it comes to esophageal stricture, damage, and issues. I guarantee. But if you do, comment down below. Let your boy know. But until next time, y'all know what time it is. This motherfucking D-Ball. Y'all stay Gucci with it.